for the use of a limited quantity of cannabis for recreational purposes. Unfortunately, Grenada has one of the most draconian statutes, the Drug Prevention and Control Act. The penalties for simple possession is exceedingly harsh. As Deputy Commissioner would have mentioned, for one marijuana cigarette, just going on the minimum and maximum penalties, you could be fined $250,000 summarily, that's with a summary infraction, and you could be penalized by having to spend 5 years in prison. That's the maximum. Now, magistrates, if you're on a summary charge, would exercise their jurisdiction to not give you the maximum penalty. But it only speaks to the draconian nature of the law itself. So that decriminalization comes in as a short and partial reprieve before you legalize, so that you could be allowed to smoke 66 grams or carry 66 grams for personal use. In most countries, before you legalize, you would want to explore the medicinal aspect, as Dr. Charles has so eloquently expressed, to determine the potency of the seeds, because once you get into medicinal cannabis, it entails a tremendous amount of scientific preparation to ultimately get the potency required for the treatment of certain ailments.
Well,
I shan't venture into that.
Let's bring in the other physician on the panel, because we do have Dr. Thompson with us, and he is the CEO of the CMA, the Cannabis, the Medicinal Cannabis Authority. So, Dr. Thompson, if you can just share with us what obtains in St. Vincent. In other words, what is the mandate of the CMA, and what has been your experience as you would have moved forward with enacting the legislation that gives teeth to this new legislation?
Well, first of all, let me say that I practice medicine in the United States, and in terms of when I was trained, I was never taught a lot about cannabis other than to tell patients to say no. And it wasn't until the early 90s when I saw my HIV patients losing substantive weight. I used to give them anabolic steroids and Megace, other type of substances to keep their weight going. One of them came to me and said that in New York, they were allowing persons, if a physician recommends it, to use cannabis to put on their weight, to keep their weight stable. I said, I never heard about this before. I'm not going to be in here. I called my lawyer, and he said, yes, there's a limited window to do this. And the long and short of the story is that I saw hundreds of my patients who were losing weight put back on there. I didn't quite understand the reason why. But in 1995, scientists, University of Tel Aviv, discovered a new system in our body. In other words, I've been taught that there were 11 systems in our body. And here was a 12th system, the endocannabinoid system. Receptors and so forth, and it was all well explained. And now I could understand why cannabis works. Now, fast forward, St. Vincent went through the same process. We have the same Drug Prevention Misuse Act. We had situations of young males having criminal records and so forth, never being able to get a job again, in any substantive way. And in after the CARICOM report in 2018, we legalized for medicinal cannabis. We didn't legalize for recreational, we legalized for medicinal cannabis. Since then, the MCA was established with myself as the CEO, and we've seen some over $30 million in investment, both at a local level. The traditional cultivators, believe it or not, we gave them a free license to grow. All they needed was application form, but other individuals basically had to pay substantive amounts for licensing. The long and short of it is that today we've had legal banking established. We've established a state-of-the-art laboratory to test the products and talk about what Mr. Cloud was saying, the actual science of what is there in the product, how safe it is, not just the potency of the THC and the CBD, but other cannabinoids, as well as the terpenes, as well as making sure toxic substances like lead, mercury, and bacteria and other things were not there. In short, we've also been able to establish a patient access system. We trained over 160 medical personnel, doctors, pharmacists, even some nurses. And one of the reasons why is that in medical school, people were not being taught about this. I listened to a lot of Rastafari who used to talk to me and tell me cannabis has these properties. I used to laugh. I want to apologize today because we were wrong. The Rastafari were right. There were some substantive properties in these particular products. And we have approved over 20 medical conditions. Let me say some of the conditions like appetite stimulation, sleep disorders, certain other things, they require more of a THC strong component, whereas others like anxiety disorders and some of the neuro problems, they require more of the CBD dominant type products. And we train people in how to properly use the cannabis. We've been able to export. We have a system in St. Vincent where local patients are able to obtain a medical card. It's prescribed by their doctor. And we also allow for, since 70 countries have legalized, for the concept of the visiting qualified patient. Somebody come from the United States, from Germany, from England, whatever the case may be, and has a card or can prove that they basically have, and they could use it not just from a pharmacy, a purchase from a pharmacy, but also use it in what you call a consumption lounge. I hope to talk a little more later about the consumption lounge. Long and short of it is, we've seen some dramatic things, that 50% of the patients are female, 50% are female. That whole concept of young males being the individual to use cannabis has shifted to older individuals, especially elderly persons who have arthritic pain. They're using creams and other things like that. Due to the lab and our stringent push for standards, quality, we think that, and we know the technical barriers to trade around the world. We very early on, we said, we are not going to be described as Nazareth. And let me say that very carefully. And you know, the concept that nothing good comes out of the Caribbean or out of Nazareth. We wanted to ensure that we were producing high quality products. And a number of companies have obtained what's called World Health Organization GACP standards for the cultivation, and others for GMP standards for the manufacture of products, creams, oils, droppers under the tongue, capsules, and so forth. These are produced here in St. Vincent Grenada and available to local patients as well as the visiting qualified patients. I know time doesn't really allow me to get into detail, but we basically are quite happy. It's important that as the United States is about to reclassify cannabis from Schedule 1 to Schedule 3 in the next 3 months. They're going through the same process as Grenada. They're going through public consultations now. The United States is going through public consultations on the reclassification of cannabis. and it's going to take place probably by August, September, and you're going to see floodloads of Americans coming down, even bringing their products with them. I don't know how the Deputy Commissioner is going to deal with this. We've had to set up various protocols. But I want to say that one of the main things, besides decriminalization, depenalization, we have introduced a concept of non-legislative tolerance. Persons are allowed to have a maximum amount of 56 grams, but what if they had 57 grams or 58 grams? And we've looked at that and said, we need the Royal St. Vincent Grenada Police Force, and probably you need the Royal Grenada Police Force, if it's still named that way, that they basically would exercise that element of tolerance as opposed to how they handle these particular type of cases. So let me stop there before going on, and I hope that gives a picture of situation. But we're quite pleased with St. Vincent. We're willing to share a lot of our information because what is happening in the rest of the Caribbean is important to us. And we don't want the Caribbean to be branded as a place where anything goes. We want it to be known as a place of quality. Grenada is known for its spices and its quality and so forth. And basically, we certainly want it to be known that cannabis comes up with.
ACP Cohen, I'm coming to you. That shift in culture, how do you anticipate the Royal Grenada Police Force responding to the decriminalization of cannabis, and how easy really it is, because we're speaking culturally now, how easy will it be for the force to be able to respond to this shift? And we're not even getting to discretionary amounts as yet.
But interesting for us will be the fact that we are a creature of statutes. So whatever the legislatures deemed necessary to enact is what we enforced. There will need to be a cultural shift within the rank and file of the RGPF, no doubt. Because for years, we have been doing one thing one way. And now we will be asked to do the same thing in a different way. But what's important for us is the fact that we have already trending in that particular direction. Though we're still making arrests for some quantities, in the last few years, we have toned down our approaches towards possession of small quantities. In fact, before this committee and before this government, there has been moved before to sensitize the RGPF as to where the trend is going, where the country is moving. And so that posture has started to filter through the ranks and file of the RGPF. So we have not been, quote unquote, stringently enforcing the possession of small quantity as I speak. So we are already there. So when the legislation comes, it's for us to say to the rank and file, we are here now. So what we have been practicing in the last couple of weeks and months and years is now for we to go full force ahead and look at the legislation. The doctor spoke about legislative tolerance. We're currently doing that. I think Mr. Clouden could bail us out on that. We have not been stringent on possession of small quantities currently, and so it will just be adopting the new posturing when it gets here.
Okay. Dr. Charles, you heard Dr. Thompson explain how the decriminalization of marijuana for medicinal use has been operationalized. Do you have any thoughts as to how we go about this? And I probably would have to bring back Dr. Thompson on this, but the testing to ensure that this particular farmer is producing the right mix, the right grain, as opposed to another. And hence, so that's one part of the question. But then, who is qualified to prescribe within the medical fraternity? And those are things I know that you have been thinking of, because for the rubber to hit the road, for medicinal purposes, who's qualified to make those prescriptions, who dispenses, and how?
Well, these are very, very important questions and very relevant. Now, one thing I hope that was understood from the presentation from my fellow panelists in St. Vincent is that it is not just a straightforward strike of the pen and tomorrow you have medicinal cannabis. Because the standard for any medical product is quite high. I mean, certainly, if we consider entering a medicinal cannabis industry, there are many steps that we'll need to follow. The doctor mentioned some of them. We would need to build local capacity for testing and for testing of these products. But in addition to that, you need to build the capacity of healthcare providers because, I mean, it is a fact. In medical schools, substances like cannabis are treated like illicit substances, and you are instructed on the symptoms and how they are observed and how the negative outcomes should be treated. All right, but now you need to build capacity in among healthcare providers as to how to potentially use it, and I say potentially use it, to alleviate certain conditions. Right? So that must be taken into consideration. There's a lot of work that will have to go into this. So no one should enter, should be thinking about, you know, I simply go and I plant a plot behind my house and I start selling it, and that is medicinal cannabis. That is not medicinal cannabis. All right? It is a highly controlled and highly regulated sector.
And are physicians qualified to prescribe? I mean, you know, and Dr. Thompson alluded to, I believe 10, he said, ailments that a physician can prescribe. But at this stage, as we look at Grenada, who are the physicians that are duly qualified to make those determinations and to prescribe in what quantity, etc.?
Right. So that would be a difficult one for me to answer right now. Because like I say, we would need to build capacity. Now, there are physicians that I'm sure have various degree of knowledge on cannabis and what it can potentially be used for. And there are a limited number of conditions where derivatives or cannabis-related products have concrete indications for treatment. All right. So those are the easy ones. We have a few FDA-approved, compounds. So those can be referenced immediately. However, there would need to be some attempt to build local capacity among healthcare providers in this sector. Now, countries have approached this differently. All right. In the U.S., you can get a recommendation from your physician to use cannabis. It is more difficult to get a prescription because a prescription requires you to outline the medicinal product, its presentation, the dosage, the frequency, how long, all of this. With cannabis, this is not readily available, right? So there's a lot of work that will have to go in. So like I said, right now in the US, you can get a recommendation based on your condition that cannabis you may benefit. Now, one thing that must be stated, yes, cannabis can be used in a number of diseases, all right, because it assists in alleviating the symptoms, all right, and persons need to bear this in mind. It's assisting in alleviating the symptoms. It does not modify the disease, all right, and that should be taken into consideration. It assists in alleviating the symptoms. So I have not read anywhere where you use cannabis for X disease and it cures it. That simply does not.
But if somebody, for example, has chronic pain and it relieves it, then it will be of benefit to them.
Exactly. And there are some indications where cannabis is recommended for the alleviation of that.
Thank you very much. Viewers, it is time for our second break, so we will take this break and come back with this interesting discussion. And I promise you, you will have a chance to weigh in when we come back.
Way Forward for the Cannabis Industry, a production of the Government Information Service in association with the Cannabis Working Committee, other media entities, and partners. You're tuned into the live multimedia panel discussion on the way forward for the cannabis industry, a production of the Government Information Service in association with the Cannabis Working Committee, other media entities, and partners. You're tuned into the live multimedia panel discussion on the way forward for the cannabis industry, a production of the Government Information Service in association with the Cannabis Working Committee, other media entities, and partners. You're tuned into the live multimedia panel discussion on the way forward for the cannabis industry, a production of the Government Information Service in association with the Cannabis Working Committee, other media entities, and partners. You're tuned into the live multimedia panel discussion on the way forward for the cannabis industry, a production of the Government Information Service in association with the Cannabis Working Committee, other media entities, and partners. You're tuned into the live multimedia panel discussion on the way forward for the cannabis industry, a production of the Government Information Service in association with the Cannabis Working Committee, other media entities, and partners. You're tuned into the live multimedia panel discussion on the way forward for the cannabis industry, a production of the Government Information Service in association with the Cannabis Working Committee, other media entities, and partners. You're tuned into the live multimedia panel discussion on the way forward for the cannabis industry, a production of the Government Information Service in association with the Cannabis Working Committee, other media entities, and partners. You're tuned into the live multimedia panel discussion on the way forward for the cannabis industry, a production of the Government Information Service in association with the Cannabis Working Committee, other media entities, and partners. You're tuned into the live multimedia panel discussion on the way forward for the cannabis industry, a production of the Government Information Service in association with the Cannabis Working Committee, other media entities, and partners.
Cannabis Working Committee is responsible for engaging the public as it maps a draft policy and then submit its recommendations to Cabinet on the way forward for the cannabis industry in Grenada. A responsible approach for its medicinal benefits, potential economic growth, educational awareness leading to improved social justice, and health and safety is crucial. The mandate of the Working Committee and the proposed draft policy is now under the microscope. Stay with us and have your say. The recently...
Viewers and listeners, and of course you are a part of this first national discussion on the way forward for the cannabis industry in Grenada, and I'm going to keep my promise. I said you're going to be involved, so we're going to start with our in-studio audience, and a representative from the Grenada Rastafari Cannabis Corporation will be posing the first question, and of course you will have the opportunity to call in as well. So over to you.
Yes, good evening to all, and I greet you in the precious name of His Imperial Majesty, Jah Rastafari. Yeah, Dr. Sean, you mentioned about the use of cannabis, but what you mentioned about the complaints and symptoms, is there any scientific evidence proven that cannabis does not cure certain disease? Is there?
Right. So, from all scientific literature. All right. What I could find is growing evidence that cannabis can alleviate symptoms of disease, but I have not found a single instance where it was documented that after the use of cannabis, a disease was cured or eliminated. There are many instances where they refer to the control of pain, the reduction in the frequency of seizures, the reduction in vomiting, stimulating appetite, but I have seen no instance where it was documented that cannabis has cured a particular condition.
Would you see that the people you're getting this record from failed to provide that evidence?
Well, that is an interesting way of looking at it. The scientific community is the scientific community, and the literature is the literature. The scientific community is diverse. It's not located in a particular region, and the evidence comes from everywhere. I am certain that if it was documented that cannabis did cure a particular condition, I mean, there will be scientists, there will be healthcare practitioners who would be ready and willing to publish this.
What I will really tell you is that these things have been still suppressed by the International Cannabis Commission. Most of this evidence is being suppressed because from a Rastafari perspective, we have proven that a very long time ago that is helped in quite a number of illnesses and cure illnesses. And later on, we will figure that when we establish a proper cannabis medical and sustainable market in Grenada, we'll provide that evidence to you.
Okay.
Yeah.
Thank you very much for that. We do have a caller online, so let's go to the caller online. Good evening, caller, and welcome. Good evening. Are we not hearing the caller? But Dr. Charles, if I may, just as a follow-up to the question, glaucoma. I know that there have been conversations late 80s, early 90s, Morrison, Fletcher, on coming up with what was proposed to be a cure for glaucoma using byproducts from cannabis. Have you heard of this one, and how would you juxtapose that claim, although it has not gone to market, so it has not been commercialized? But I believe I will always wait with my question. Let's go to the caller online. Good evening, caller.
Hello?
Yes, we're hearing you. Go ahead.
Right. Very interesting discussion. Just want to say my hats off to the panelists and also Dr. Thompson. But I just wanted to ask, cannabis 15, 20 years ago is not the same cannabis today. We have seen all kind of cannabis come in to Grenada, tainted with very high levels of THC. So when we are considering decriminalization, is it the same cannabis, or would there be steps in testing to know what levels is allowed? Thank you.
Thank you very much for that question. I struggle to hear the actual question. We spoke of the importation. Caller, if you can give a short back, and to our technical operator, if you can repeat that question so it can be shared with us in studio, because we had difficulty due to the quality of the sound. But Dr. Charles, glaucoma and cannabis, and then I would like you quickly just to pivot to cannabis as we know it in Grenada, weed, and hemp, which we can see being sold in the shops. And I would like to certainly have an understanding as to why what is grown here is illegal and what is imported is not. But glaucoma we'll start with.
Right. So first, as it relates to glaucoma, I mean, it's a condition that occurs as a result of increased pressure in the chamber of the eye. Now, certainly there is some reference to cannabis, or cannabis products being used in the treatment of glaucoma, but not for the cure of glaucoma. So in this instance, it would be to assist in the reduction of the intraocular pressure, but it certainly will not modify the underlying condition that led to the increase in the pressures.
Okay.
in the-
And
in
quite
the
quickly,
eye.
if you can pivot, because I know we'd have to be very sensitive to time. We do have a caller online. So we'll take the caller online, and then we'll come to an in-studio call. So go ahead, caller online. Good evening.
Hello?
Yes, we're hearing you. Go ahead.
You hearing me?
Yes.
Yeah, well, I am not really a doctor or scientist or anything, but I have a couple of friends that I know personally. You see, the smoking of this marijuana, that's not a good thing. I have friends who smoke marijuana, and Mr. Doe, you wouldn't believe how that thing destroyed those guys and them brain. As a matter of fact, recently one of them, some gentlemen, one of them take a knife and was going up the road all up in St. Paul's, all kind of wasted people. And as far as I understand, and this person wasn't predisposed to being psychosis or whatever you call it. That person was just ordinary thing. And those, I know personally, that thing destroyed those guys' brains. So I'm calling on all here who want to legalize this thing. Be very careful, because I've known people also that apart from destroying the brain, it impairs your judgment. Like, for instance, you'll hear people say, he behaved good all the time, but as soon as he smoked, he carried on. So it seems to me, I'm not really a doctor, but I'm just saying what my observation is, that marijuana does affect your brain and impair your judgment. And it's not something that probably you should legalize in terms of smoking. Yes, in terms of probably medical benefit, and I hear what the doctor was saying about it really doesn't cure. I understand that is also because I had a friend, as I hear people used to say, they used to take the root of the marijuana.
Thank you very much for that. Thank you very much for that, caller. Certainly that perspective and the caution that this caller is asking that the committee is exercising, and hence the discussions, hence the consultation and movement towards recommendations. But we do have a question in studio, so go ahead.
Yes, this question is for Dr. Shan, sorry. It's pertaining to the tetrahydrocannabinide that you say that causing mental illness and other symptoms when people use it. But to my studies as a student of medical cannabis, I know that there is cannabinoid receptors in the human brain. One is called CB1 receptor, which regulates THC, tetrahydrocannabinide, and filter it. And there is another one called CB2 receptor. One is in the right brain, one is in the left brain. And these receptors was created by the creator to regulate cannabinoids, to regulate the chemical of cannabis. Do you have firm evidence that THC or tetrahydrocannabinide responsible for any form of sickness or indulging in increasing of the pain or increasing of any form of illness within the human body?
So it is well recognized that THC is the component of cannabis that is responsible for the psychological symptoms that are experienced by individuals, and it does so by its work on the CB1 receptor. All right. What we are speaking of is basically the endocannabinoid system, which is another system in the body that helps to maintain a state of, we call it homeostasis, but we say a state, let us just call it a state of normalcy. And what has been demonstrated is that the cannabinoids, like such as THC and CBD, they work on this system, and that is how they do what they do, all right? And it was demonstrated that the THC is the component that causes the psychological symptoms and that creates dependence. The CDB, on the other hand, to this is attributed a lot of the medical benefits because its work is a little more complex. It works on several areas within the body, and there is interest in it as a result of these.
Okay. I believe we do have a caller online, so let's go to the caller online. Good evening, caller, and welcome. Okay. Good evening. Oh, I thought I heard someone joining us. My apologies. Mr. Cloud, because I'm going to get to Dr. Thompson shortly, but I heard Dr. Thompson reference in St. Vincent the legalization for medicinal purposes, and he was very specific on that. Is this the thrust of the data gathering of the working committee, or is the committee looking to take a step further to go beyond that? But we do have a caller online, so you'll be able to respond after. Good evening, caller, and welcome.
Hello, good evening. My question is to the medical persons on the panel with regards to persons with autism and the use of cannabis oil. Because I've read that cannabis oil aids in the transformation of persons with autism, meaning that children that nonverbal, etc., the use of cannabis oil, the right potency of the cannabis oil. I've read that it assists in the aid of transforming that person or individual with autism. So I'd like to hear the feedback from the medical persons on
Thank you very much.
with regards to that.
Thank you very much for that, caller. Yes, thank you very much for that. And I will just ask both physicians to weigh in. So I'll give Dr. Charles, I'll give you a voice arrest and ask Dr. Thompson for the use of cannabis in the treatment of individuals with autism, one, and two, your experience, because I don't want us to only focus on the smoking of cannabis, but the other ways in which the properties can be utilized for medical benefits. So Dr. Thompson, let's start with you, and then we come over to Dr. Charles. Use of cannabis in autism and other diseases, and how are they prescribed for use?
Well, as I had said before, St. Vincent, we have approved over 20 conditions. We have a system by which other conditions can be approved. Autism is one of those. Now, I want you to understand that after over 60-something years where cannabis has been demonized, you could not do research on cannabis. Physicians were trained in a particular way to avoid it. I mean, when I practiced in the United States, I prescribed all the different synthetic opioids, fentanyl. And let me say today, fentanyl that I prescribe is killing over 106,000 people a year in the United States. And that's one of the reasons why they're in the United States, they're looking at cannabis, because they're realizing, you know what, basically it is not producing that level of harm that, compared to these other drugs as cocaine and so forth. Now, let me, in terms of autism, yes, there's some benefits. And with some of these conditions, the 20 and more, some conditions you are seeing dramatic effect. I don't make the distinction between symptoms and disease, condition, because conditions have a series of symptoms. If a patient is suffering with pain, that's significant. If a patient who has an anxiety disorder, the underlying cause of the anxiety may not be known, but the CBD basically is being used quite effectively in the treatment of the anxiety, and that's what the patient wants. They want results. Now, in the case of autism, I would say that there hasn't been a substantial amount of research, but there's been results. And so the autistic societies around the world, many of them have been using cannabis and advocating cannabis in measured and small ways. I would say also in epilepsy, we saw the whole Sanjay Gupta episodes about epilepsy. That those patients, those conditions are not common, but the patients had relief. They had relief from their seizures and so forth, and that's what's the important thing. I would say that in the case of St. Vincent and the Grenadines, we expect that the top 4 conditions where we see use is sleep disorders, pain disorders, anxiety disorders, as well as some appetite things. We have not seen persons using it in the case of some of the rare diseases, but there are these rare conditions that do benefit from it, and research is still ongoing.
Thank you very much, and we do have a caller online. Good evening, caller, and welcome. Good evening, caller. Okay, seems like we have lost that one. The distinction and the mandate of the working committee, medicinal purposes or other? Or is that a result of the discussions like tonight?
Well, I think we have omitted one important aspect of the use of cannabis, and that is the religious. The Rastafarians have led this this chant for the use of cannabis sacramentally for religious purposes. Antigua came out big on this because the legislation prescribed sacramental dispensaries. They can plant unlimited number of trees around the tabernacle. They can have dispensaries where they can sell to the
Okay, if
fellow
I may,
Rastafarians.
right, we do have a caller online, so
Yeah.
let's take that caller. Good evening, caller, welcome.
Hi, good evening.
Good evening.
Yes, can you hear me?
Yes, we can, go ahead.
Oh, okay. Yeah, while I do not have a problem with use of marijuana for medical or religious purposes, I am a bit concerned about the use of marijuana for recreational purposes and the protection of our children, young people. And the reason being, as has been scientifically proven, the brain is not fully developed until we hit the age of about 25. Am I on?
Okay, the comment.
Hello?
Yes, go ahead, finish your thought.
Yeah, so yes, so the brain is not fully developed until the age of 25, and of course marijuana impairs the development, the continued development of the brain, so impairs the development of the brain. So that's one. And two, of course, again, for the young people, many of them do become dependent on the drug. It does have some dependency. And then thirdly, the popular way of using marijuana is either smoking or vaping, and both of those are bad for our lungs and have serious health implications. So I would like to address this to Dr. Sean Charles, in terms of the effects of marijuana on the brain of our young people and their health. Thank you.
Thank you very much for that. Dr. Charles?
Certainly, the caller has raised a very, very key issue and a very, very key consideration of the committee as well, because the neurodevelopment, the development of the brain, all right, of the adolescent, young adult, does not complete until maybe around the age of 25 and so on. And during that time, the brain is very vulnerable to substances such as marijuana, all right? And exposure to these substances can cause lasting complications, like behavioral issues, their ability to learn adequately, all right? Memory issues. So hence the reason why it is very important that in all of this, we ensure that cannabis is not made available or is not made easier for young individuals, for children to access.
Thank you very much. We do have a caller online. Good evening, caller. Welcome.
Hi, I was wondering, since our economy is so heavily based on tourism, doesn't it make more sense to go from a recreational perspective so that we can benefit financially? The only other thing I wanted to mention is, in terms of medical marijuana, where are we going to be getting it? Because medical marijuana can't even have a fly, an ant, or a cricket or a grasshopper even land on it. Inside a medical facility, nothing can touch it. It has to be clean. It can't even be grown in plastic pots if you look at what the new mandate is for medical marijuana. So where are we going to be getting this marijuana from? That's all. Thank you.
Thank you very much for that contribution. We will have comments on that contribution. And we did hear you in terms of the recreational to support the tourism industry and the strict measures that are needed for medicinal marijuana. We do have one question in studio, so we'll take that question before going to our break.
I would like to answer part of the question from the caller. The issue of recreational marijuana or medical marijuana, it doesn't start overnight. And it's important in the St. Vincent, as Dr. Thompson said, the Rastafari is involved in the growing of medical and recreational marijuana. So the issue in Grenada, these must be advocated, these laws must be implemented, that we get the right into the marijuana industry holistically with the administration of Grenada. Because we don't want the synthetic, he mentioned it, most of the cannabis coming from outside is synthetic. And we don't need that. And this is what destroying the youths. Mr. Thompson made that, explain it to Mr. Clauden on a program just a couple of Sundays back. Is the synthetic cannabis that causing a problem, not the organic cannabis. And the market is now calling for organic cannabis, and Grenada is a place for that. That's why we protest and we advocating as the Rastafari. We be part of the industry.
Okay. Thank you very much for that. Callers, viewers, we're going to take a short break and we'll be right back.
You're tuned into the live multimedia panel discussion on the way forward for the cannabis industry, a production of the Government Information Service in association with the Cannabis Working Committee, other media entities, and partners. You're tuned into the live multimedia panel discussion on the way forward for the cannabis industry, a production of the Government Information Service in association with the Cannabis Working Committee, other media entities, and partners. You're tuned into the live multimedia panel discussion on the way forward for the cannabis industry, a production of the Government Information Service in association with the Cannabis Working Committee, other media entities, and partners. You're tuned into the live multimedia panel discussion on the way forward for the cannabis industry, a production of the Government Information Service in association with the Cannabis Working Committee, other media entities, and partners. You're tuned into the live multimedia panel discussion on the way forward for the cannabis industry, a production of the Government Information Service in association with the Cannabis Working Committee, other media entities, and partners. You're tuned into the live multimedia panel discussion on the way forward for the cannabis industry, a production of the Government Information Service in association with the Cannabis Working Committee, other media entities, and partners. You're tuned into the live multimedia panel discussion on the way forward for the cannabis.
The Cannabis Working Committee is responsible for engaging the public as it maps a draft policy and then submit its recommendations to Cabinet on the way forward for the cannabis industry in Grenada. A responsible approach for its medicinal benefits, potential economic growth, educational awareness leading to improved social justice, and health and safety is crucial. The mandate of the Working Committee and the proposed draft policy is now under the microscope. Stay with us and have your say. The recently
viewers, and we of course having this first national discussion on the way forward for the cannabis industry. What the caller just before the break was addressing well, two things really. One, the contributions of cannabis to our tourism industry being one, and also if we are to use cannabis in the medical industry, the stringent regulations that governs that. And Dr. Thompson, St. Vincent and the Grenadines has been basically at the vanguard of medicinal marijuana, certainly within the OECS. So if you can share with us who gets licensed and how, with some of the categories for licensing as we put a wrap on this evening's conversation. But I'm very interested in how one is licensed to supply in St. Vincent.
Now, we don't make a distinction really between cannabis for the local market and cannabis for export. But each country you are looking to export will have different barriers to trade. I'm sure you would have known that in banana and spices and so forth, things like that. And there are a lot of technical barriers to trade, so that there are a lot of things that one has to meet, the testing and so forth. For St. Vincent, we still go through that process of testing, but the traditional cultivator, whether Rastafari or a person who's been engaged in this industry, and they said we have issued them with a free license. They have to pay an application fee. We renew those licenses. And the policy has been that the major producers have to buy a certain amount of their produce from the traditional cultivators. It has worked fairly well. And traditional cultivators have been paid and received money for the sale of product. At the same time, even though I would say that companies would have brought in, let's say, master growers, you know what they found? They found that the traditional cultivator understood the climate, understood the agriculture, understood the soil issues and so. St. Vincent has a very special soil, so that's one issue. But understanding the climatic condition, how the plant grows, is also critical. So a lot of local traditional cultivators have become very important in the whole production process for themselves and for various companies. And they have been able to receive checks, money, and so forth for the sale of products. From the standpoint of, we have a policy that is not recreational, but we understand that a substantial amount of people coming from Canada that has legalized recreation, and many states, and people coming from the United States, that they basically have the various credentials, prescriptions, certificates, medical certificates, and so forth, that qualify them to use that. And so we've been able to utilize what we call consumption lounges, as well as pharmacies, by which they can, at the cruise ship berth, we have several of these consumption lounges, and persons under certain conditions are able to utilize it in very distinct spaces that have been cordoned off and so forth. So I understand some of the issues with respect to the fear of recreational, but I would say that the trends are, and let me say, the trends are going to continue, and I say to ease that pressure on the world-graded police force to focus on other things. I think that they would actually be best served if there is that particular process of legalization, at least for medicinal purposes.
All right, thank you. And it is coming to a wrap, and ACP Cohen, as you give some closing comments, what would you say are the greatest concerns and possible challenges for the Royal Grenada Police Force as we move forward in these discussions and subsequent implementation?
Well, Colin, we have been receiving quite a lot of calls for services in what can be deemed marijuana related from quite a lot of our young people. In fact, it is well known that we have been active responding to a lot of these calls and taking people to the General Hospital and subsequently to the psychiatric unit at Bungay in what is believed to be marijuana related. Now, I don't know the science on this. We as law enforcement don't know the science on this. But if there is a correlation between those behaviors and marijuana, as we develop the industry in decriminalizing, we'll have to look at the health sector, the social services sector, working simultaneous with what we're doing. Because if it becomes decriminalized, the question is, will more be used? We don't know that. But if more is being used, then obviously, if what we currently see and believe is true, then it cannot just be the decriminalization by itself, in and of itself. Other sectors of government, other supporting mechanisms would have to be put in place to ensure that the fallout from the use of those are being adequately taken care of.
And Dr. Charles, the very same question for you. As we march forward on this movement towards the responsible use, medicinal use of cannabis, what do you anticipate, what is, in terms of what gives you some anxiety, what would be your caution to the Grenadian population and to your working committee comrades?
All right, so there are a few things that are of concern to us in public health. One is with this whole change in the perception of the change in approach to cannabis. One, there is a decreased perception of the risk and an increased perception of the benefits, right? So, I mean, we know that there are many anecdotal, unsubstantiated claims that cannabis can do this, do that, cure this, cure that, and so on. This needs to be tempered to avoid miscommunication and harms. We're concerned about increased uptakes by persons who are not using cannabis now because it is more available. And the more people that are exposed, the more you may see persons presenting with complications. And as a result, it will become a burden on the health system. Now, we are also concerned about increased availability and now minors potentially becoming exposed to cannabis, all right? And of course, I already mentioned about the development of the brain. We have to look at the quality and safety of products. If we have, if it is now not a criminal offense to have a quantity, then there are always individuals who would look to bend the rules and adulterate products, and it will cause many individuals to fall sick because now it's legal to possess a small quantity, but it's not just cannabis. It's probably cannabis mixed with amphetamines or cocaine or crack or something. So that is a concern. We are also concerned about the social consequences. We already have an issue with alcohol. Grenada, heavy consumption in the population. Cannabis, this is just another substance that persons can indulge in and can lead to the already negative consequences that we already see. We're also concerned about occupational health, because now we're talking about driving under the influence, operating equipment under the influence, all of these. And all of these has an impact on public health. And then crime, right? Crime is a public health issue as well. It was well articulated. So it requires a high degree of responsibility among the Grenadian population, because we are now asking persons to be more mature. The state is no longer going to be the body that is holding you back from trying and using cannabis. Now you must take that responsibility and live with whatever consequences.
All right. Mr. Clouden?
Quite frank, I think cannabis has been ostracized and attributed for causing mental illness and the like. That is not true. My own perception is, in recent times, we have had an increase in crack cocaine, and a number of young people have been gravitating to crack cocaine, and this results, no doubt, in hospitalization and the like. Dr. Sandra Gupta once said that you cannot overdose on cannabis, and you can't overdose on it. And it is not an addictive drug. That's what the literature seems to caution. It's not addictive necessarily. And it doesn't encourage you to move to a higher drug if you consume it. Cannabis, ganja, has been around for thousands of years. Our forefathers smoked it. The Rastafarian community use it sacramentally and for religious purposes. I am yet to see some of them crazy, walking around like zombies. So that, there's a lot of fear. So what we really need is a legislative framework that would, one, prohibit young people under the age of 18 from consuming cannabis. And you put that in the legislation. You cannot smoke in public places, around schools, hospitals, and the like. The legislation would prescribe what constitutes a public place, and it would be prohibitive to smoke or to be seen around those places with cannabis. Schools, hospitals, and the like. So that I am troubled by this fear attributed to the use of cannabis. Just ask yourself. Canada has legalized it. Germany has legalized it. England, likewise. St. Vincent, Antigua, Dominica, St. Kitts Nevis, the United States of America. They have just moved it from a Schedule 1 to a Schedule 3. It's now a ticketed offense rather than a criminal offense. We have to think and keep pace with the international community because they have had sophisticated scientific experiments done that would have caused them to legalize cannabis. Germany recently proclaimed that 4.5 million people were smoking cannabis or consuming it, not medicinally, but for recreational purposes, and as such, they legalized it. On the 1st of April, it was legalized. Medicinally, they've set up scientific centers, and they're continuing to do research in that area.
And that I think is the important point, because I think it's time for us to wrap because we are at time. You're continuing to do research,
of course,
I think is critical. So Mr. Anselm Clouden, Chair of the Working Committee on Cannabis, Dr. Sean Charles, our CMO, ACP, Vanny Cohen of the Royal Grenada Police Force, and of course online we had Dr. Thompson from the the Medical Cannabis Authority. Thank you so very much, all of you, for joining us, and to you, our viewers and listeners, for being a part of this evening's discussion. This is a national discussion. It is not a one-off. This is the first in a series of conversations that are geared towards leading us to making a mature decision on what the cannabis industry, if embraced, should look like. The conversation should be open. Conversation needs to be continued. We need to explore all options and look at the cold hard facts in order for us to be able to make sound decisions and to help the working committee to make their recommendations to cabinet. They have a short deadline because they're looking at September. So in subsequent discussions, please feel free to come out, to participate, let your voices be heard, and let Grenada join the train in a mature manner as we too look to take on and wrestle with this particular drug, and I use the word drug deliberately, that is part of our culture, that has benefits, but responsible use, like with every other substance, being key. Thank you so very much for joining us, and we look forward to having you part of this discussion as we march forward in looking at the appropriate way to embrace the cannabis industry here in Grenada. Good evening to you all. God bless. Take good care.